Dear doctors, friends, and ladies and gentlemen, welcome to Omnicuris Day. We are going to meet and greet one of the legends in medicine today. Friends, as you can see, Kapil Dev, Messi, or Amitabh Bachchan, they are all legends in their own field. They were not just born like that, as you know. They actually found, hard fought, and they chiseled their path to perfection. That's why they are all here as eminent personalities. Profession, especially in this COVID pandemic, you know the value of the surgical nursing staffs and fraternities. And the surgeon, as such, it is a great field, as you know. It is a very unique field in one way or other, because by a stroke of a knife, you can determine the life and death of a personality or a person. That's the thing. And there are certain interesting qualities, a great quality of a surgeon, as you can see, all of you might know already, an eagle's eye, lion's heart, and a lady's hand. And here we have, I'm Dr. Ishwar, going to take you to Dr. Ramen Goel, one of the pioneer in bariatric and metabolic surgery. He's a director, he's working in Wakar Hospital in Mumbai. And we are going to spend some time with him to know all the ingredients for a successful practitioners. Because to make a lasting impression in your life as a surgeon or as a doctor for that matter, I think you have to climb in the ladder, first as a child, then as a student, then as a teacher and a trainer and a legend. So it is a long journey. Let us talk to him and welcome him. Please join me to welcome Dr. Ramen Goel with me. Hi, Dr. Goel, how are you? Nice meeting you.
Good evening, Ishwar. How are you?
They're all waiting.
Sure,
I'm very well, as you can see me. And it's always nice speaking to you. And my greetings to you, Madhu, and also your son and daughter. I'm sure you have a very excellent family. You have, I think that is the one of the pillars of your strength. I'm sure about that. Apart from all your hard work that is paying the dividends as you are. We are seeing you today. I'm going to just ask, because as we know each other for more than 10 years now in various platforms, especially in IAG as one of the largest academic organization in this world, I think I want to just know a little bit more about your childhood, not only for my own benefit, for the benefit of all the audience. The young doctors are waiting to hear from you, because Mother, Pita, you know, they are how important to design our destiny in the future. I don't think anything is better than just asking something about your birthplace. That is a Mathura. We know the Mathura, the holy city. And I traveled last time to Delhi. I was passingly, I wish I spent some more time in Mathura, because that is the birthplace of Krishna. Now I know it is the birthplace of Rama. That is a Ramen Goel now. And a beautiful place, I'm sure. And I'm sure you remember the time you spent with your parents, because I understood you were there till you were +2 or 12 years there. Please trace the history and tell what are the things you enjoy that cherishable moment in Mathura.
Thank you, Ishwar. I wish you had stayed back at Mathura for a few days. You know, we still have a house and a hospital there, and this would be a pleasure to host you anytime there. As far as my childhood is concerned, you know, I go a little backward. You know, I'm a third generation doctor. So my grandfather, whom I never saw because we lost him quite early, just after my birth, he was a doctor in a British Army, and he gave up his job in response to the Quit India call in 1942. And he settled down in a small town near Meerut called Mawana. And he became quite well established, because he was became a freedom fighter, and then he was the only qualified doctor in tens of kilometers there. And I grew up hearing stories about his exploits, as one can say, because he would be traveling in a tanga those days with a horse-driven cart, and will go to different small villages to treat emergencies, even though he had only a clinic there. One story that I recall is that, you know, there's so many stories about him, that he went to some village and then he found that one gentleman was in acute retention of urine. And those days, people were relieved with a rubber catheter. And that day, as it happened, it wasn't there in his bag. Doctors used to carry that bag in their hand. So he innovated and he used a peacock feather to catheterize the person and relieve him of his agony in that village, because the nearest help was about 70 kilometers, and that too, there were no cars those days. And those kind of stories were a sort of eye-opener for a child, that you can be so innovative and think about local solutions. And then my father, Dr. Ramen Goel, he became a chest physician, but he was sent by the government to learn lung surgeries in 1949 to Switzerland. That's where most of the tuberculosis surgeries were being done those days. There were no cardiothoracic surgeons those days because there were no cardiac surgeries. And he came back and he started a sanatorium in Mathura, which would have over 100 patients indoor. And he would do lung surgeries in open ether anesthesia. So those who are listening to this will realize. And that open ether anesthesia was given by a veterinary surgeon. Mathura had a veterinary hospital. Mathura has a veterinary hospital. And one of the colleagues who was a veterinary surgeon would come and give open ether anesthesia. And they would do lobectomies, pneumonectomies those days, because there was hardly any anti-tubercular treatment those days. And this continued till 1968-69, till this gentleman stopped giving anesthesia, and there was no other anesthetist in Mathura. And so my father had to stop those surgeries. So those are the kind of folklore that were there. And we were staying in a house was within a compound of the sanatorium. But now I realize that we had those social distancing that people are learning now. In those days, till that time, all the four of us, all four brothers became adults. We never entered our hospital because my father said tuberculosis is an infectious disease. Nobody was allowed to go to hospital. And each time my mother would come back, she would change her clothes and then take care of the kids. So those were the kind of social distancing norms and infection control measures that we saw. And then obviously my mother, though she was not a doctor, but she was highly educated, was the caregiver for the entire hospital in terms of dispensing of medicine, giving them counseling, feeding them. And being a social worker, there would be hundreds of visitors at our house every day. There were intellectuals who will come for discussions. There were people who will come for conservation of culture in that area, Braj culture. And there were farmers, housewives, divorcees. They will come to seek our help. And that is where my upbringing was, meeting those people throughout the day. Our house was like an open home where at any given time there were 20, 30 people sitting and chatting at different levels. And I think the most important lesson that I remember from my childhood is about respecting the people who work with you. So every staff that was working with us, we were never allowed to be disrespectful for them. And they were from every possible religion and community, and there was no discrimination ever. Because you are from a particular community, you cannot employ other. So I think the overall environment of inclusiveness started from there.
Can you remember this particular picture? I'm very fond. You are midst of all your classmates, I think, in your school time. I don't know which time and what occasion. Can you just recollect any fond memories as a child when you were studying in the school in Mathura?
So this is not a school picture. This is a picture of my medical college first year. But as far as the school days are concerned, I studied in Central School Mathura, and the school days were absolutely carefree and relaxed. There was just no pressure in terms of performance from the parents or the family, and so there were never any tuitions. The modest grades that I got were always celebrated. And if I didn't get good marks in some subject, it was never even discussed that why you have not done well. Sports were integral part of our life, So I was good in playing basketball. Cricket and football were regular things. Athletics was so regular in those days, So we will participate in long jumps, high jumps, running. And then social sciences were so important. We had activities like dramatics, project-based learning. My daughter has done in the international board. I think our board those days, Indian boards were better than even international boards of today. We were mostly project based and so much more inclusive in terms of learning. And then the school days, I think the most important thing I realized is the family was so close. For almost 5 years, my brothers would pick me up from the school every day and drop me. Whether it's extreme winter or extreme heat or rains, they will come on a motorbike and pick me up and drop me. I think that kind of bonding is so important. And so I think the school days were just fun, and that's how I want to always remember them.
So you are you're quite a big joint family. Was it unlike today's era where people are living in their small apartments with one or two children and they have to grow? Now you have a lot to learn from your brothers and sisters and all the people. I think it's quite amazing. I think usually in those times, even for me, it is a fond memory. Whenever there is a school holidays or things, you like to go there and spend the time. And there's no TV or no thing, but still, and the day goes by just playing around, just to go outside and see. I think they are all lasting lessons in our, and the pleasant memories, I'm sure you'll be tracing. Let me take you to your college days. Like I'm sure you took medicine not by just an accident, it is by your choice. I'm sure by looking at your history, I don't think you would have thought anything else. And you took the medicine and joined Jain Medical College. Then you also spent a lot of time in Grand Medical College as a postgraduate and also as an assistant, I gather. And I just want to ask you, as a student, and how you enjoyed your life as a medical student, and how was the life there, and how you think when compared to the life as a medical student now, people, the way they spend time to go through the NEET, spend the time and training. The training in those years and the training now, a real bedside teaching, the simulation teaching. There are a lot of things are changing. Your views and things to the people watching you, the students, youngsters are keen to listen to you.
So before I go to, I think that's very interesting question that you asked. Before I go to the clinical part of it, clinical learning, let me say that, Jain Medical College is part of Aligarh Muslim University. And I was fortunate to join that university. And my journey through that was felicitated by one of our family friends, Mr. Sultan Muhammad Khan, whom my mother used to call Sultan Bhai. And why I'm saying about the university is because there were opportunities where I could learn sitar in the university. I could go and perform in a drama in the Kennedy Hall, which was a large auditorium where thousands of people could see it. There were even in medical college days, we have a sportotsav, which would be like an intercollegiate sports festival. And all this probably played more important role in my life later on than the formal education in the wards and in the classrooms. I never appreciated their importance when I was going through it because it was more of a fun kind of thing. But later on, I realized that this is more important in life because it gives you the kind of confidence to stand on a stage when you don't have to deliver a dialogue like in a play. So when you stand on a stage in an association program or somewhere, you don't need to fiddle around. You can stand still and you can deliver. So I think overall development of a person in a college or a school is more important than the formal education, because education I realize is an ongoing phenomena. It's not about what you learn in a school or college, but it is what is your quest to learn throughout your life. As far as the clinical part of learning is concerned, medical college in Aligarh had all full-time doctors. So those days we did not have honoraries or part-time doctors. And it was a great learning because, my department of surgery would have a clinical meeting every day at 8 o'clock in the morning by the clock. And this gentleman, Professor Ansari, so one day we would have a mortality meeting, one day we will have a research meeting and like that. And everyone has to be there, whether you had an emergency overnight, you have slept or not slept, 8 o'clock, everybody has to be there. And that would last for 1 hour and that would set the agenda for the day. And these full-time consultants would be there to supervise our work and let us work more, give us more free hand than in any other place that I have worked later on. I remember my guide during my postgraduate days, Professor Iqbal Ali. On emergency days, we will have patient, let's say an appendicitis patient, and patient is there, and at 12 o'clock midnight, and he will say, okay, do this. He will delay the surgeries. And whenever emergency is getting over at 8 o'clock in the morning, and he will say, Raman, go ahead and operate him now. And I'll say, I had been waiting to operate. We could have finished the surgery at 4 o'clock. Now this is the time when I have to go and sleep, and he's asking me to operate. And he will stand outside till I finish the surgery. And he says, only if you will learn how to manage these cases late, then you can manage an acute case. So everybody will not come to you in first 2 hours. Some patients will come after 10 hours. Some patient will come after 48 hours. And if the patient requires surgery, you have to learn to operate. So I think the consultants there gave us a lot of confidence. And I feel that kind of full-time working, and that included many things, on festival days, we would go to their house. So if was a Eid, I will go to my professor's house and have sheer korma and things like that. And if on Diwali, we'll go to other professor's house and have. So they were all staying in the campus. They were in walking distances. And it was like being a part of big university, which is missing in most of the medical colleges in big cities, because there is no campus kind of feeling that was so much there. So I think I am blessed to work there. And again, another thing that I saw there, which is different, is that the teacher will always remain a senior will always remain a senior. So all those people who are my seniors would continue to host me even today, which I cannot, even if I am successful in my life, I cannot tell them that I will pay the bills if we are dining together. They will always. So that kind of camaraderie and relationship has lasted over generations.
I think that is a very, very fond memories you have. Like what I asked you about the training, what we had those days, and the training, what the people nowadays pursuing. Not much of a clinical bedside teaching, and even whatever little they are going to learn nowadays is more of a simulation, or they go and sit in front of the computer, or just to go through the books and mug up and just go and pass this NEET. But do you think it is a necessity now the way the training is going to go, or you think there is a lack of human touch? What do you think?
No, I don't agree that today we are not doing the right thing. Things are changing. So human touch, I completely agree, but that's a different thing. The simulation is the need of the hour. We need to work on machines more before we do the same kind of thing on patients today, because we have the opportunity to do it on machines. Those days we did not have that opportunity, and that made the responsibility of the teachers even more. So I think it is a transition. I don't say that today what we are doing as teachers is wrong, but as far as human touch is concerned, I completely agree with you. Human touch in medical science is so important. I remember there was a girl in my postgraduate days who had substantial burn, a young girl, a 10, 12-year-old girl, substantial burns on her body. And every time she required anesthesia to change her dressing because it was so bad. And I could sit with her and talk to her, and gradually, piece by piece, I could change the dressing. It would take, instead of 15 minutes, maybe about 1.5 hours each day of changing the dressing, but I could avoid anesthesia. And I realized, and as she started calling me a brother, I realized that human touch is more important than the clinical part of it. And there have been many such learnings in life. I was working with Dr. Shikhande in Mumbai during my residency days, and a senior gentleman, I still remember, he had a green color Mercedes with a number of 786. He came for a surgery to Professor, and I went for his dressing, and that was the first time I changed his dressing. And then he said, "Doctor, you will be very successful in life." And I said, how are you saying? I mean, he must be about 75, 80 years in life.
I'm nice to hear that. And I just want, I think once you finished, I think you went briefly to Vienna also for a training in GI surgery, because it is a very challenging time. Those days, if you want to pursue anything in pursuit of excellence, we used to travel abroad to gain. But I'm sure now things are different. I think the youngsters now have more opportunity. There are more experts. There are more excellent avenues, even within the India. All they have to do is look for the best center where then they can go. But can you just recollect those, whatever little time you spent in Vienna, how was it at that time, and how welcome you were to the places, how they were helpful to up your career in the field of surgery? Raman.
Yeah. So I think education in Europe is those days was very different experience for us, because we were like general surgeons going there, and I was a fully trained surgeon. I went about 3 to 4 years after my post-graduation. And Europe was like a mixture of personal healthcare like in India and formal healthcare like in US those days. And I was part of a busy liver transplant team in 1992, where that team was doing about 80 transplants those days, liver transplants, which was a very big number. And those days, liver transplant was just beginning to start in India, and that was an amazing experience, because I learned respect of blood vessels, handling of vessels, and the professionalism and dedication towards patient care. Because any liver which was available in any part of the Europe, the surgeon would travel overnight, take out the liver, bring it back, transplant it. And it would take about 48 hours continuous working for a surgeon to get the thing done, the entire team. And it was an amazing experience. And then besides the training, of course, Austria is a beautiful country. So we have, pleasant memories of that place. So those were the days. And as you rightly said, those kind of training facilities were not available in India those days. But people, I mean, why we talk of liver transplant? I'm even talking of laparoscopic surgery, which started in 1990 in India, and we started this at the same time, and it was such a challenge that, and many of us were traveling overseas just to learn laparoscopy, and now we are a training center for so many countries.
Yeah. I think like you also, when I also traveled to UK, what I noticed is, I'm sure the hands-on experience you can get better in our country, but still, when you go there, the systematic approach, the clarity in the thought process, and also accountability. Once you are a house surgeon or when you are a SHO, if you offer a job, that nobody else, only you have to do whatever is assigned to you. And also the clarity, like as soon as you go into hit the tube train in London, you know the color coding and the clarity. So that way, whatever we do now, like writing a book or even a guidelines, you know, it has to be understood by even the everybody in the team. So you learn beyond surgery and beyond medicine. That is the beauty. And also you understand the culture and their manners, good manners. There are a lot of things to gain apart from just a surgical skill. I think that is the one I'm sure you still enjoy, cherish those moments, isn't it?
Absolutely.
And one thing always frustrates for youngsters is a long surgical career, when their colleagues in other field like engineers, by the time they start earning, once they finish learning. But here we have to do an undergraduation, and then a couple of years to sit for postgraduate need, then enter 3 or 4 years of postgraduation, then super specialty. Even then it may not be, you have to have a focused training on something like a metabolic surgery, laparoscopic surgery and whatnot. So it's an uphill task. I think we need to keep the tempo, and how it is possible. What is the motivation you can drive to the youngsters? How, because to get the fruits of the pudding or the harvest, I think the waiting time or the incubation time is quite long in surgery or medicine for that matter. What's your advice you give for young surgeons these days? Because they want to gain, they want to see the results the next day.
I sometimes have always a contra view to the common perceptions, Ishwar. So people always compare medical with, let's say, those who have done engineering or who are in software or engineering, and people who have done those kind of things. But what we need to realize is that when we do a 4.5 year or 5.5 year course, we are at par with an engineer. Most of them go for an MBA. So they work for another 3 years and then they go for an MBA. They are still studying and then they start. So their career is not only 4 or 5 years learning career. They are actually 8 to 9 years. And then they get a job in a bank or a financial organization starting from the bottom. The only problem with the healthcare in India, education healthcare is the remuneration for postgraduates. Remuneration for postgraduates in, let's say in UK where you got trained, is substantially higher because they are complete doctors. They are taking care of the healthcare system of their country. Now, the postgraduate education in India has to move out of medical colleges. They have to go to the district hospitals and primary health centers and hospitals where they provide the health care to the citizen, and at the same time they are completing their post-graduation. And if they do it, if the government changes the system, and I am aware of this because I'm also close to National Board of Education, they are changing this and they are making it happen. And if that happens, doctors will be given salaries at par with any consultant or a professor in a medical college. I'm talking of postgraduate doctors. And if that happens, this kind of frustration will go away, because when you pay them 20,000, 30,000 or 50,000 rupees after 6 or 7 years of learning, it is definitely inadequate. But overall learning period is almost the same, whichever branch of the career you see. If you add their post-graduation or specialization, it becomes almost 10 to 12 years. So I don't agree that we have a much longer learning period. We have almost the same learning period. Only the financial remuneration has to be brought up at par with other specialties, because we are delivering a complete service. Like let's say in COVID, if a doctor was working in a hospital, appointed in a hospital to provide healthcare, he deserves to be paid at par with any other professor, because he's independently taking decisions in an ICU or in a ward. And government will happily do it if the education moves out of medical schools into healthcare system. I think a lot of things have to change, and I completely agree and sympathize with the postgraduates today. But probably it's a process in evolution.
Thank you. I think once a person gets qualified as a surgeon and come to a place, something like a big city or a metro like Mumbai, there are thousands of surgeons like you. They want to build their own little empire there. And is it because of their hard work, or a blessing, divine's blessing, or a bit of a luck, or a mentor? You are in the right platform or a right corporate structure where they can just give you guidance. I think you are lucky in that way. I think you chose the right person. Those days, people used to go and throng this place, the Ronacharya of surgery those days, and I'm sure Srikante. I think you are lucky to have his guidance, I think. And when I asked him about you and your time with him, this is what he said about you.
Yes, sir. He came to me sometimes in 1993-94. And as you know him, the moment you saw him, you see a very handsome, tall man with a constant smile on his face. Normally, handsome people are not humility, but he was full of humility. And I found one thing, he was very inquisitive of what we were doing. He stayed with me for 2 years with my clinic, and he must know one thing, he had named her daughter by the name Shreya.
Okay, yeah.
Because the name of my nursing home is Shreyas. So he has given name of my hospital to his daughter. But tell me, what more can you expect from the student? I asked him, what did you learn from me? Because this is a question I asked to all my students. What did you learn from me? And he says, so your thinking, your analysis. Because most people say, so your skill. But a great compliment for a surgeon to know that he's a thinker. Otherwise, we talk only about skills in life. I think he was very inquisitive. He was open-minded. He would disagree with a pleasant face, ask you questions, and that makes a man a very different man. Can you believe when the COVID thing started here, he was the first and only man to tell me, sir, COVID has come. Please take care of your health. Raman, I am very proud of you for your achievements. I remember the first time you met me in 1993, I think, and I was impressed because you were.
I think that was Professor Sri Kante. I think you had a good time, like you, Kushal Mittal. A lot of people are benefited by his blessings and guidance. About your, time at Pune with Dr. Vinayak Nagesh Sri Kante, Dr. Goel.
Yeah. So, I mean, he's in Mumbai only, and we worked in his clinic in Dadar. And so one thing is, I believe that everyone should have a mentor. You should be choosing your mentor and getting help. Like you said, Dronacharya, if you want to go to, you need to find your Dronacharya and be with him and learn from him. Time at his place was amazing, because as I mentioned, it was beyond the surgical skill. So it was after I came back from Austria, I wanted to start a liver transplant program. And he was head of the department at Bombay Hospital. And he said, Raman, come and join me and we will start. Unfortunately, Bombay Hospital never took it on priority and the liver transplant program never took off. But working with Dr. Sri Khande was learning things beyond surgical skill. How he talked to the patients, how he planned surgical list, how he spoke to them after surgery was over, how he handled complications. So I remember a guy who had a post ERCP pancreatitis in our clinic, and we shifted him to Bombay Hospital, and unfortunately he couldn't survive. And there was a crowd of at least 500 persons. He was a very politically important person who died. And this gentleman, Dr. Sri Khande, whom we fondly call him VNS would stand there in front of those 400 people all alone, a frail man, and he would stand his ground and say, we did this, it is a known complication, without any fear, without any risk of being of a physical or a verbal assault. And the confidence with which he spoke to them, because he was speaking to all of them throughout, ensured that there was no assault on him or the team. And I have learned the beautiful handling of complications from him, that if you are communicative with your patients, if you're transparent with your patients, generally things don't go wrong. And everything, preparation of lectures. I remember he had an oration to take in Nashik, and those days we did not have the PowerPoint. We used to have those slides, and we would sit with him every day for 3 months before the oration, and we would go with thousands of slides of his, one by one, shortlist them. Next day again we change the shortlist, and he will see every slide and decide. And that is the kind of preparation that I learned from him. When he will go to do a surgery, he will, in the car, so many times I will be driving his car and to Bombay Hospital, and he will sit with a book and he will go through the anatomy book in the morning. And I said, sir, you know all this anatomy. He says, Raman, if you are prepared in advance, you have less complications. So we would switch off the music and he will concentrate on the book, and if he finds something different, he will immediately say, Raman, do you know I learned something new this time. So I think this focus on your profession is what is so important, and I imbibed everything from him, and I'm eternally grateful for him, because even today when I go for something important, which could be a lecture or sometime I used to do interviews on Doordarshan, thanks to my friend, I'll switch off the radio and I'll be mentally preparing my questions as I am driving to the studio of Doordarshan. And so, avoiding distractions, avoiding noises in the operation theaters, how do you remain focused on the job at hand, is all a gift which I got from my mentor. And this is so important in life. And that is why I say everybody should hitch their wagon to a mentor, because they are not only for the time that you spend with them, you can always go back to them, even if it's once in 2 years, and clarify any doubts that come in your mind in future.
That's great. I think you had a divine blessing to have somebody like Venus as your mentor. I think that is the thing, because something like the simple bedside manners, or how to break bad news, or when not to operate, the art of finding that answer, all those things are not described in our books. However much you are a student, I think these are all the things. If you just work with somebody experienced and so compassionate surgeon or human surgeon, I think these are all the things. I think invaluable time you had. I think that is one of the important thing why you are here like this. I think partly, I think you owe all these things to VNS, I think, to a large extent.
Absolutely. And many other teachers
Yeah. I think next, of course, I mean, we always in the medicine, we always nowadays people keep postponing this familyhood or parenthood, because they finish their post-graduation, they go into the MCH, by the time they become in their 30s. But I think, I hope you had the marriage or your destiny. I think you have a lovely wife, Madhu, and also you have a very two nice kids. And I always admire this picture. You're just sitting with them on them either side. They see how you are eating, and I think they learn a lot, like what you learn from your parents and grandfather. I think they're also learning from you. I think this is, as a caring father, like a compassionate thing. I think while you are pursuing for excellence, I think you are able to give a quality time to the family. And how important is this one?
So I think family is so important. I'm not going into when you should have a child in your career. I'm not going into it. But the family is the foundation around which you build your career. Because if you have a peaceful home life, it allows you to diversify, and that can only come when you are at ease with your family members. And there are situations where you are uncomfortable because of some differences, and then you are uncomfortable in the operating room also. So I wish patients should ask this question to the surgeon: do you have a good dinner with your wife yesterday? I mean, are you okay with your wife? Because these are such important issues, and this can only happen when you make sure that you are open about things at home. When you try to keep things to yourself, your successes, your failures, your challenges that you are, so it's reversed. So when you do something in the workplace and you don't share it because you want to hide it from the family, that causes problems at home. And when you do something at home and it reflects in your work, at your work. So I think gradually family is so important, and I am blessed that we.
I think the other thing I really admire, I'm just admiring is, in addition to your quality time, the right time you just in pursuit of excellence, you were able to focus, like you found the Arjuna in you, something like that. You were able to see, I can't just go just to do yet another general surgeon. Do something different. I think that is the time. I think that is the vision you had in your mind, going to various places in this globe, like going to Professor Michel Schutter to know the gastric bypass, or to go to the Lyon University to meet and spend some time with this Professor Vincent to know the gastric bypass, or even spending a lot of time with one of the pioneer in bariatric surgery, like Matthias Phoebe, and everybody very fond of him. And I think those are the things which kept you in the focus, that I am now going to practice nothing but only the metabolic or bariatric surgery. That is I think a very important decision, career decision you made. When and how you were able to make that decision, and how you enjoyed these precious moments with these three great personalities, Dr. Goel.
So Ishwar, I was never having a plan in place. I was just going along my journey as a surgeon, and which was difficult. Which was difficult in initial phases because I was an outsider to Mumbai, and Mumbai has a hierarchical system because it's a small city, and so I was going on until I came across Dr. Dhore Patil, who started bariatric surgery from Pune. I went and I was very fascinated to see his work. So it was just an incidental situation that I was at the right time, at the right place, and I met the right person, Dr. Dhore Patil. And then, as it happened, that I said, okay, let's see what is being done outside India in this, because only Dr. Dhore Patil was doing it. I was the second one after him, and so I went to Michel Souter, who was working in Lausanne, which is a small city in Switzerland, and he would do about 2 to 3 gastric bypasses a day, and a great expert. And on day one, he said, we have a senior person from India. So Raman, would you mind holding the telescope for me? You have been doing laparoscopic surgery for so many days. And he gave me a 70-degree telescope to hold in a gastric bypass, a surgery which I had never done or assisted or seen. And after the surgery was done, he told his fellows, look, this is the way angled telescope should be held. And I had never held a scope which was more than 30 degree those days in India. They were not available. So that was my experience with Michel. Then Frering in Lyon was doing mostly gastric band. I went to get trained with him for gastric band. And I found that he was operating on about 10 patients a day from USA who will be brought by insurance companies to get a band done. And he would finish a gastric band in 12 minutes on a morbidly obese patient. And I was amazed. And I said, if patients can travel from USA all the way to Lyon, a small city, it was not a small city in France, why they cannot travel to India? That opened my eyes towards medical tourism. And that was a great learning. But I think the ultimate was Dr. Mel Phoebe. Dr. Mel Phoebe ran a very organized program in LA. An entire department, and he would do 2 surgeries a day, banded gastric bypass. And our conversation with him was always about safety of bariatric surgery and long-term outcomes. And that was a great learning, because everybody was talking so much about the technical side of it, and he gave me the holistic view of bariatric surgery. How do you look at it? And besides the clinical part of it, he is extremely gracious host, he and his wife. And I have seen that, and he is at a different level. He's a gentleman, a thinker, an excellent surgeon, all together. And for me, this exposure of working with these people and many others, like I went to Orio de Paula in Brazil, another master surgeon in metabolic surgery. All this brought a lot of brought me down to a level to realize that there is so much to learn and to develop in bariatric surgery. And that is what made me realize that bariatric surgery is indeed a necessity of the hour. It was not about that you are specializing. It was more about that patients need it. Even in my family, there are the morbid obesity runs, and I knew the difficulties people face. And for me, it was a natural choice that I take bariatric surgery as a career. And it took a long time to take off. We started somewhere in 1999, and I became an exclusive bariatric surgeon in 2011. So it took me almost 10 to 12 years to decide that I can become a completely only a bariatric surgeon.
Having gained so much of insight and also all the exposure and also the wisdom, I think you started doing this one by one, and I'm sure it would have brought some flutters or butterflies in your tummy when you did your first so-called gastric bypass in your own small little place in Mumbai, or all the first gastric band. And what about your preparation the previous day, and how was your team, and how you are able to bring this one to a center of excellence? I'm sure there are lots of difficulty. You had the opportunity to excel at the same time. All the difficulty you need to go through on that phase, I think that is a challenging moment for any surgeon. Always, you can always have an easy way out, but you took the path to perfection. Even though it is a difficult terrain to traverse, I know the world is going to be very beautiful on the other end. That's what you did, rightly so. And your team is proudly watching you because of those sleepless nights you had in those days, I think. Can you recollect those memories?
So if butterflies means nervousness, I had probably buffaloes in my stomach. Those days, we did the first gastric band with a single chip camera. This was in 2000, 2001, I believe. Single chip camera. And I had a mechanical insufflator. I did not had a electronic insufflator. And as it happened, and I had an anesthetist who had never given anesthesia to a morbidly obese person. I mean, he was one of the best that I had access to those days. So he was not relaxing the patient because he thought that if a patient will be relaxed, patient will go on a ventilator and will never come out of ventilator. He was not relaxing the patient. Mechanical ventilator refused to insufflate against that resistance. So ventilator collapsed in between. And ultimately, we had to convert it into an open surgery. Fortunately, and Dr. Dhore Patil was with us because we were just two surgeons who were able to work together on this initially. And so it was a gradual learning against all the possible odds. And, to tell you, even to do a port closer, I went to a cobbler in Chembur, and I saw how cobblers stitch a shoe from inside. And I sat on the side of the road. I had a good car those days, better than what I have now. And I parked the car. I sat down in my jacket, and I said to cobbler, I said, can you show me how do you stitch from inside? And that is how the suture passer needle got developed. It has different names now, and the big companies have acquired the patents on it. But the port closer needle came from that cobbler whom I went, and I purchased that needle for 20 rupees those days. And I modified it, went to a person in near Sat Rasta in Mumbai. I said, I want something like this. And that is why he made that needle which opens in front, where you can hold the suture. It was very challenging, Ishwar. When I did a gastric bypass, the first banded gastric bypass, I remember I took a very long time. And those days we would take a break in between after 3 to 4 hours of surgery for a meal break. The entire team will go, will freshen up and come and finish up a surgery in about 8 hours. And most of the time I'll call up my friend. You already took his name, Kushal Mittal. I'll call him up, Mittal, have I made a mistake of going for bariatric? I don't think this is doable in India. And he will only ask, is the patient okay? I said, yes, patient is okay, patient in ICU, but I believe I should not do it. He says, okay, you have a beer and sleep. And by next day morning, when you go there and you see patient walking and being happy, you suddenly forget all your worries. So I think this journey was in laparoscopy also, when we used to use those security cameras, and we would use the instruments which were not designed for laparoscopy in a proper way, local instruments. I think surgeons later on, so I used to break in gallbladders in 1992, about 4 hours to finish my gallbladders. And my trainees and my fellows now routinely finish their first gallbladder in 40 to 45 minutes or shorter. So I think this is the advantage of having mentors in your city, in your institution, where you can gradually learn one step at a time and become a perfect surgeon by the time you come out in practice. It's a wonderful journey, and I enjoyed it. Now I can say I enjoyed it. Those days were difficult.
I think it is something like you are building yourself, brick by brick, I can see, because we always say laparoscopic surgery is a painless surgery, but it is from the patient's perspective. But when you finish a long surgery, when you go home, you feel somebody could give a massage. You have a neck strain, shoulder pain, whatnot, I'm sure. But I think those pain are pleasurable pain, I would say, especially when you have a patient with a smile on the next day. I think that's what you had. I think that kept you going. I think that's the main thing, isn't it, Tom?
My son would walk on my feet, my legs sometimes. Sometimes my daughter would do that. I mean, when they were small, when they saw me very tired, and they would do it. So I think the massage facility was available those days, which is no more there for me because they've all grown up. I can't even think of their walking on my feet. They will break now.
And I'm sure it's not like yet another appendixectomy or a gallbladder surgery. Here, you may have to talk to about hundreds of patients in order to convince and counsel one patient to theater. I think in bariatric, things may be a little different now, but those days, I'm sure the amount of awareness you need to do for the public, convince them that surgery is good, safe, effective, I think I think you need to have two tools. One, obviously your knife, but of course you need to be really communicative. The words also equally important. The surgeon should be a good compassionate person, a good person, convinced that surgery has to be done. I think that knack, I think that can't be taught. It has to be learned in a hard way. How you learn that skill?
So let me be very confessional today. The surgeon learns the communication comes from your own confidence. So if a patient would ask me those days, everybody would ask, so doctor, do you think there is a risk? And I will say, yeah, there's a 1% risk, because we have seen those risks in Western literature. And they will say 1 in 100 patient may not survive. I said, yes, this is what the data says. And many people never thought that they will take that kind of risk. And this is because we were not confident that these surgeries can be safely done. Nowadays, when a patient relative asks, because we have done so many surgeries and we have seen that it can be done in most of the patients with minimal or negligible major mortality or kind of complication, our language changes and patients are able to sense it. Our confidence level reflects in our mood and our communication. And this can only be learned by watching other surgeons who are more senior, more confident, that how they communicate, especially the complication part of it. Every patient who comes to us and their family members now wants to know, always want to know what can go wrong, what is the downside of it, how many surgeries you've done. And if you've done 10 surgeries, they are aware that you have not done over 100 surgeries. So one should be very honest in their communication. And if you are honest, they are able to sense that, and that helps. You don't need to say, I am honest that I'm telling you I have done 50. You don't need to say that. If you are openly talking about your experiences, I believe in basic intelligence of people, and they immediately understand why we are saying what we are saying.
I think, Dr. Goel, if I see the first few years as a bariatric surgeon, when I see, I'm sure with those cases, I'm sure even when you go and to the bed to sleep, I'm sure you'll be wondering next day morning when I go and see the patient, hope he is fine, no tachycardia, abdomen is soft, things like that. I'm sure you have only a light sleep and a stressful time, but in spite of the stress, you have some stress busters, and I'm sure your family was backing all the time. Your Madhu, I think, being along with your team, I can see her always time as a dietitian. I think she is in the right place. Like me, my wife, she is as a manager. We are going to the hospitals, same vehicle, come back. I think that's the way it looks like, an extended family commitments to your patients. That's the way you see it, and you enjoy what you do, and you start loving whatever every day takes you. And here is what your daughter says about
question,
you.
But I think Papa's always been so much more than all his amazing achievements. He's been such an incredible father. I mean, you know Papa. Since I was a kid, Papa was the one who used to dress me for school. He's responsible for all our Sunday lunches, for all those cakes I got, irrespective of my marks after each exam or test. It didn't matter how busy he was. He's always been there for us emotionally and physically. But I do remember quite a lot about your professional journey. I remember when I was really small and you still only did sort of general laparoscopy and I think even urology. We used to go together on your evening rounds to Swastik nursing home, and you always left me at the nurse's desk or sometimes in the car. And you were always late, but I still went each time because I loved the drives, I loved the time with you, and I loved hospitals. I remember later on when you started bariatric surgery, you used to do those public health meetings for obesity all over the city on Sundays. And there was always something wrong with the projector or the hall. And I used to be nicely reading my book in a corner, eating away whilst there was mayhem going around me. I remember later, I think it was maybe in 2000, 2002, when you sort of were appointed at Bombay Hospital. And we all went for a drive to South Bombay at night, had some ice cream. And I remember thinking that, I've never seen you more happy and there can never be a better day. But I think there have been a lot of better days since. You've had an amazing career, continue to have an amazing career. And, we've all kind of gone along for the ride. But I think sort of what's not changed is the person you are. You've always been so strong on what you think is right and what your beliefs are, and encouraged us to do the same. You've always had an inherent sense of decency, which I've been really, really proud of. In terms of how that's affected me, obviously, I chose to do medicine, and a lot of that has got to do with you. I think if you were anyone else, it would be incredibly stressful to be your daughter. But because you're you, and I know that you see us for who we are, I know that I just need to keep trying to be a little bit better, keep pushing the envelope a little more, and hopefully one day you'll be really proud of me. So yeah, incredibly proud of you, Papa. Can't wait to see what you achieve next, because I know nothing and no one's going to stop you.
I think you have two lovely children. I'm sure that is you are also very fortunate in the midst of the pandemic. You had the lucky one to spend some time with your daughter in UK last month.
Yeah, we are already so proud of our kids, and we had the opportunity to travel to UK just before the second wave started, and it's an amazing journey. And she is working in NHS, and she calls up and she has difficult cases, and she would discuss those cases. And being a doctor, it's so much easier to relate to them, though she's going to be a physician. But that's amazing, amazing journey for her and for my son who is in Goa and working. Yeah, one is blessed to have kids like that.
I think a couple of things I just want to know, because nowadays we say you need to have an ethical and moral. You should not have an ethical and moral dilemma whenever we make a decision about a treatment for a patient. And to make a simple understanding of ethical practice, what will you tell to the youngsters nowadays trying to do an ethical practice, Raman?
So, Ishwar, lot is being made about ethics, medical legal issues, practice. For me, it is very simple. I believe that what you can do it on your brother or your mother or your wife or your sister is what becomes ethics. So if you have to offer a surgery to another patient, all that you have to think, and you are in a dilemma. If ethics don't come in picture, exactly following, if the patient comes with a clear-cut picture where the guidelines are clear, or if a patient comes with a picture where the guidelines say surgery should not be done, the problem is gray zone. Now, in gray zone, it's very simple. You just have to think whether you offer this surgery to somebody in your family with equal vigor as you are trying to sell it to your patient. And then the ethics of marketing and advertising. I think this is a very big problem in our country, that doctors are, just like any other profession in our country, are restricted, unlike hospitals, in talking about their work. I'm not saying it is wrong. I'm just saying this needs to change. This needs to change the way it has been changed in UK, where every doctor's audited results are put online by the GMC. So it's not that you should be allowed to advertise, but your results should be seen, so the people can decide. The way we decide about a restaurant by the rating, people can decide who has better outcomes and where I should take my relative. It should not be a lottery that you go to a doctor. So I think ethics is a matter of simplifying life, making decisions easy, and wherever in doubt, don't. So if you think that you are doing something which is like an advertising, don't do it. If you think you are advising a surgery which you should not be doing it, don't do it. And it's as simple as that. And your competence and your experience determines the level of your the work that you can do. So once I was asked to speak on this topic about ethics in Mumbai, and marketing and advertising, and I said it all depends on your competence. So basic requirement is the training. If the person is well trained and is doing a camp, this is not advertising. And young surgeons must be very clear in mind that ethics is a guidelines. They are not law of the land. This is like saying that respecting your senior is an ethic. It doesn't. It is not. It's basic tenet of life. So ethics are basic tenet of life, and every doctor must follow them. These are non-negotiable. They are not law of the land. Obviously, if you do something, you may get away with it, but you will not get away from your own conscience, because it will keep on. If something goes wrong, it will. You might cover it up, but it will keep on niggling you. You may not be able to sleep that night. So I think, as a young surgeon, as a young doctor, what I can tell these young people, be honest to yourself. And if you are honest to yourself, you are an ethical person automatically.
I fully agree with you, Raman. I think from a surgeon, young surgeon, having had so much of training, so much of hard work and commitment, now trying to become somebody like a trainer, a trainee is now grooming himself after decades of commitment to a trainer and also a leader. I think it is a great feeling trying to able to teach whatever we gained, the knowledge we are able to share, because sharing of knowledge, I think that is a wealth. I think the generations are going to appreciate your commitment, either teaching or writing papers. I personally was associated with you only 3 papers, but I can see you are a voracious reader and also writer. Wherever there is a time, I think you spend, your hobby is more into nowadays, how I can express myself in this academic forum in whatever way, and it's useful for the society. I think you have done, and also as a leader, you proved yourself. Initially as a treasurer, later as a president IAGS, in the most difficult time in the history of IAGS, as a 16th president. We say fondly the pandemic president last year, you did it. And when I was standing along with my colleague Satyapriya, we thought, okay, we are going to have another year of traveling to various places and enjoying the feasts, academic and also gastronomic. But we had a difficult, challenging time. We were all sitting there because of this COVID, all of us know, with everybody locked in. But I think you came out. I think it is where you said the importance of the collective wisdom, sitting together across the table, see, brainstorming, get the team think for you, and see what is best from them. Then we did this initially for the task force for COVID. Then we did the fellowship, what was on-site became in online. Then we were trying to knock the door of our neighbors, trying to involve them in our academic collaboration, and even to have a grand gala online, what we are doing now, online chatting, similar one. The first one for me as a personally is the Indo-UK Surgicon. So there are learning great moments for me, and I'm sure you. I think we did love whatever we did those days. What about your feeling as IAGS president, briefly, Raman?
So I think you have summarized it so well, Ishwar. We worked together. Whatever, just like a surgeon gets the credit for a surgery, the president gets the credit. But we know within our heart that it's always the entire team in a surgery, the nurses, the assistant, anesthetist. Similarly, here you were the man, you were the person on whom I built the entire IAGS activities last year with Satpriyo and so many other people in the association. So I think leadership is an opportunity for you to do what you always wanted to do, but were not able to deliver. I sometimes pity those leaders who criticized others when they were not in leadership positions. But when they reached there, they did exactly the same what their predecessors have done, for which they were being criticized. I think a leader must have a plan. And because now he is the one who can get it implemented, that is the time one should do it. And this is IAGS presidentship, or when I was president of RO, gave me precisely the opportunity. Why I mean presidentship? Even when I was a treasurer, I before being a treasurer, I saw what was being done, and I thought, why this cannot be changed? And when I became a treasurer, I got everything implemented. So I think it was a great exercise in democracy, inclusiveness, and more than the association, it was for my inner happiness. I will remember these days with great satisfaction and pride that I could do whatever I wish to do, and I did it successfully with all your support.
Thank you. Thank you. And again, Raman, as you can see this picture, one of the, I think, glorious time, I think, in the fond memories of becoming the Fellow of Royal College of Edinburgh. I'm sure this is one you will cherish those moments. You traveled in the midst. I think it's just about the COVID about to knock the door, and you were in the right time, and you are the, I mean, one of the few lucky ones who got on-site fellowship of this. Just some thoughts on that special day.
So, we left on 7th of March from Mumbai for this convocation in Edinburgh. And as you mentioned, my daughter is there. So my son was accompanying us. And we went to Lake District to spend some time together. We had no clue that COVID is becoming such a big thing because we were not watching news as we were traveling in that part of the world. And the first time we realized, we went to a restaurant for a lunch in remote part of Lake District. And somebody said, "You are from India." And then one of the guests, the host, was saying, should we be asking you about some, disease or something? And my daughter said, "You should be answering more because there were more patients in UK at that time." And I said, "What are they talking about?" And then when we went to the college in Edinburgh, there was an entire different drill. They said you can't shake hands and you should move. And we were not even wearing masks those days. This was on 13th of March. And it went like a normal activity, except that we were not allowed to shake hands, but we were standing close and all that. And by the time we started our journey back on 14th, we were told that in Dubai, during transit, you should maintain distance and all that in the flights. And things were changing rapidly. It was amazing that in 1 week, the world changed. And I came and I was made to go in quarantine for 2 weeks, which I didn't know this. So a lot of surgeries got postponed, which never happened. And those patients, probably I'm operating them now after almost 1 to 1.5 years. So I think that journey was a journey of my COVID journey through UK because I was on the fringe of, we reached on 15th and 22nd, the lockdown happened in India.
I think apart from becoming a fellow of Royal College, you continued as somebody like an ambassador of Royal College and brought this very, very exciting on-site, program here, as you can see with Royal College President, ourselves. I think that is the first experience of a major collaborative international conference we had online, and it was very successful, and based upon which we recently had another conference, and now we are more and more confident, yes, this can be done in a better and bigger way. I think thanks to you and your imagination, your freedom to execute for all your team. I think that's where it comes. I think as a legend, I think you need to make a mark or impression, not only in your life, and also you have to make some changes in the people who are following you. I think you didn't see any difficulty. Wherever there are difficulty, you always see the different perspective. Whatever they look like a tumbling block, so you took it as a turning points, things like that. And it is not one day affair, I'm sure, like what I can see this quote from the Christian Bernard, South Africa. He said, one fine day he became world famous. But your life, it is not one fine day. I think you toiled over many, many years, decades, and you are here not because it's destiny. It is that thing. I think it will spell yourself. I think it is something like that. What you conceived, believed, you have firm belief of whatever, and you achieved everything. And that's why we are happy here. And I'm sure it is one of those few lifetime awards being offered to you. And I'm sure similar awards are offered in various platforms. And I'm sure I like to know what's further you are thinking. I think already we have come far enough, come to a stage of legend where you are thinking 10 years ahead of your long-term vision, because you should have that vision. You should be a visionary where you see the medicine is heading. What do you advise the students to take cues from your life as a lesson for them?
So as I said, I never have a plan in mind. I had been always a very base level surgeon and never worked for fame or success. And I'm sure Christian Bernard, when he say he suddenly became famous, he had put in day in and day out working before suddenly the fame came his way. So this is how the life should be. You will not believe, but my only prayer in my life, whenever I went to a temple or anywhere else, was that things should not go wrong in my hands. I'm a firm believer of in Vaishno Devi and in Dargah in Ajmer. And this is the only thing I say, that let nothing go wrong in my hands. And that is what is important. Now, looking forward, how do I see people where the medical sciences and careers should go? I think academics is the way. India and Indian doctors have been doing wonderful job, but we have not been maintaining data. Now, with access to digital platforms and digital learning that we had during the COVID times, it's very simple and very easy, because the data dominates the scientific world today. And if we are able to use that to publish our results, India would be further ahead. So research and data is the way ahead. And then having a larger vision and standing by it. So you mentioned about Indo-UK Congress. I'll just take 2 minutes. I would go to conferences in USA and see surgeons from 80 countries coming to attend the conference. And I would say, what are they doing different that in our country, we just get delegates from 1 or 2 countries like Pakistan or Bangladesh. We don't get delegates from Europe. And I had been asking people who are organizing conference why we cannot do that. And when I organized the national conference on obesity surgery in Mumbai in 2015, we had delegates from 20 countries, including from South America, who came not as faculty, but as delegates who paid for registrations, presented their work. So I think a vision to include people, to realize that India is a big country, we are a great country. We just need to realize our own strength and develop a system to bring it together. We don't need to make country great. We need to make our conferences, our journals great, and we need to include people. I think we are at the cusp of that. A lot of youngsters who call me up or meet me are working very hard to do this research. We have started a research committee, and researches are going on in IAGS now. I feel it's just a matter of time. The only thing that India lacks today is a public healthcare system, and that's a different thing, which the time has come to develop a world-class public healthcare system in India. And I'm passionate about it now, that somehow all of us who are in leadership position should work together to bring it to a final way, because we have seen that COVID has exposed our poor public healthcare system. So I think these are my thoughts about future of medical care in India, and that is how it should unfold over a period of time.
I think original research and publication is the way forward. I fully understand your sentiments. And now we have final couple of minutes. Raman, I just want to ask you, what is your stress buster if you are stressful day, or any escape hobby, if you ask, because you have time to spend. I'm sure whenever you find time, Juhu Beach, I see, even a single day I spend with you, you are taking me to a long walk. Is it what else you do, and how you are maintaining a good health? Because that is equally important. I think the physical health is equally important when you have a mental work day in, day out.
So I think this is the area which my friends also ask, what is your hobby? So very difficult to answer. My hobby is doing nothing. My stress buster is when I'm tired, I would go out for a walk, I would sleep it out, or I'll cook something for my family. And that I'm completely away from surgery and surgical people. And this also is such a stress buster, because if I sit down with my friends, and luckily all of them, unfortunately, they are what I'm saying is my friends, close friends in Mumbai. All of them are non-surgical people, and I sit down with them. We chit chat. They sing songs, and I clap for them, and we have some drinks and we have jokes. I think it is necessary that we have life beyond our medical practice, and these friends provide me that life. And then COVID times was a great opportunity to learn some cooking, doing some baking, doing dishes for my home, my family. And that is also a great stress buster. I started enjoying all of these activities. So I think one need not to have a hobby because the hobby should be there. one should be more in the way. And one thing that I learn is enjoy is traveling and driving. So whichever country I go, I make it a point to take a car, a good car, and I like to drive because that is how I see people on roads. They're in villages, in towns, small towns, streams, and this is life. This is the way I would like to retire, where I travel frequently and I meet more and more people, and I discuss things which are beyond surgery.
I fully understand your openness. I think I, like you, also spend at least half an hour a day spending time in the kitchen with your wife. I think there is a time. I think you live the present. I think that is a way of like a yoga. I think you enjoy and the food, and it is cooked with so much of love and chatting. I think when you sit in the table and eat that food you cooked, you enjoy that. I think that it begins the day is set for you. I think that's the way. I think there is no need for a special hobby like you need to go for a jogging or a music or a football. Not necessarily. You can, whatever you love most, live your presence, forget whole thing about your stressful surgical time. You are able to spend time, whatever makes you relaxed, feel happy, feel anger. And that's what you did. And I think you rightly did. I think what people say, I think when you ask any successful surgeon or a person, you name one or two similar people, they always find it difficult to name. That's all about legends. Legends means they think. I mean, they have come to a spot. They don't claim they are legends. They are considered as a legend because watching from a distance, like people like us, when we see you, I think you go to that stage because of the sheer commitment, passion, whatever you do every day. You like throwing the seeds on the for like plants on the things. Positive thoughts makes all these actions, whatever we do or you do, and that becomes like a habit, and that becomes our the character, and that becomes our destiny. That's what you've been doing, rightly so. I think you chiseled your path, like what I said, as a legend, to the perfection, like a carpenter chiseling like a nice carpentry work. I think that's what you have done. You are always a great inspirer. For as far as I'm concerned personally, I'm sure you are inspiring so many people out there watching, and a silent admirer. I mean, whatever I do, like even if I'm posting something in the YouTube, I enjoy. You start enjoying what you do, I'm sure people will start recognizing your work, and they'll enjoy the commitment. I think you should not expect something in return. You just do out of your sheer love of doing things. That's what you have been doing. I think you have to do and live in the present, and always remember all the memorable moments of the past, and also welcome whatever is going to be the glorious opportunities in the future. That is the way I like to live. And what's your final thoughts for the day before we say goodbye to this the fantastic platform the OmniCuris provided us for us to share our thoughts on the legends in medicine today? Raman, final thoughts from you before we sign off.
I think you have said it all. I do not consider myself a legend. I'm a simple man, and I live life one day at a time. We may be unhappy or angry with someone in hospital, home, society, or government, but that should not. We should not allow this to affect our mental peace. I remain disconnected with what I am discussing, and that's very important. I don't remember it, but in my we had higher secondary. In those days, I was taught Gita in first two chapters of Gita, and there was a shlok which said that, that you can get enlightenment by remaining disaffected by your surroundings. This can be a harbinger of Alzheimer's, But this is so important that stress should not affect you, and so happiness should also not affect you. You should be happy, you should be stressed, but that should not affect your mental peace. It is not that I have never been affected. I have been affected, and I take them as my failures or weaknesses, but that is maybe once in 2-3 years. But gradually one should become at peace in heart and mind, and that is what is so important. Because as a young surgeon, I would be very angry if something goes in the hospital, in the operation theater, with my anesthetists or with my nurses. Now that is becoming a remote, so remote that I don't even remember when I lost temper last time. I think this is comes with age, this comes with maturity. Earlier you get it, more peaceful you are with yourself in life. So I think thank you very much for inviting me here, and Ishwar, for you agreeing to talk to me today. I am honored, and I'll be eternally grateful to you.
Thank you, Raman. Thank you, team Omnicuris, friends, doctors, ladies and gentlemen. I'm sure you enjoyed this. I think we enjoyed this last 90 minutes of this interaction, bringing out so many of the features of a life of a surgeon, from the inception to that place where he is now at the helm of his life. Still, he is so humble. I think humility is one of the important character for any upbringing of any person, for that matter, being a surgeon or whatever. I think this is what happened. I think we learned. I'm sure in yet another episode of Legends in Medicine, we meet again. Until now, we sign off from Omnicuris. Thank you. Bye-bye. Jai Hind.
Thank you.